As a pharmacist, I see people make the same medication mistakes over and over again. And most of them aren't because people are careless. They're because nobody ever explained the practical details, like what to do when you miss a dose, whether you can stop a medication once your numbers improve, or why that harmless-looking supplement can completely change the equation. Some of these mistakes simply make a medication less effective. Others can actually become dangerous. So here are 7 medication mistakes pharmacists see all the time, and what I wish every patient knew instead. I'm a licensed pharmacist, and on this channel I explain medications the same way I would if you were standing at my pharmacy counter. No hype, no fear, just practical information that helps you use medications more safely and understand why you're taking them. Let's start with one of the biggest mistakes. Your blood pressure looks great. Your cholesterol comes down. Your blood sugar improves. So you think, maybe I don't need this medication anymore. That's one of the most common misunderstandings I see. Sometimes your numbers look better because the medication is working. Stopping it can allow those numbers to climb again, and certain medications can cause additional problems if they're stopped abruptly. That doesn't mean you're automatically taking every medication forever. It means the decision to reduce or stop therapy should usually be made with your healthcare provider. If you think you no longer need something, ask, don't guess. Here's another one. You forget a dose. So do you take it immediately? Skip it? Double the next one? The answer depends entirely on the medication. There is no universal missed dose rule. For some medications, taking the dose when you remember makes sense. For others, if you're too close to the next scheduled dose, you may need to skip it, and doubling doses can sometimes create a much bigger problem than the dose you missed. This is exactly why I want patients to ask one simple question when starting a new medication. What should I do if I miss a dose? Know the answer before it happens. This one surprises people. When I ask, what medications are you taking? I don't only mean prescriptions. I want to know about ibuprofen, cold medicine, sleep aids, antacids, vitamins, herbal products, and supplements. Because over-the-counter doesn't mean interaction-free. Something you bought without a prescription can affect blood pressure, increase bleeding risk, cause drowsiness, or interfere with another medication. So if you're ever wondering, does my pharmacist really need to know about this supplement? Yes. Tell us. That's part of the medication picture. The bottle may simply say, take once daily, but that doesn't always mean timing is irrelevant. Some medications need to be taken with food. Others work best on an empty stomach. Some may make you sleepy. Others may make you urinate more often. And certain medications or supplements need to be separated from each other because one can interfere with the other's absorption. So instead of only asking, how many times a day do I take this? Also ask, is there a best time to take it? And does it matter whether I take it with food or my other medications? That one question can prevent a lot of frustration. You've taken the same medication for years. Then you open your refill, and suddenly the tablet is a different color, different shape, different marking. Sometimes that's perfectly normal. The pharmacy may have switched generic manufacturers. But don't just assume that's what happened. Medication errors can occur. So if your medication suddenly looks different, look at the label, check the tablet, and if anything doesn't make sense, ask the pharmacist before you take it. You're not bothering us. That's exactly the kind of question we want you to ask. Here's something I wish more patients did. If a medication is making you miserable, tell us early. Don't quietly stop taking it for 3 months, and then mention it at your next appointment. Sometimes there are easy fixes, a different dose, a different time of day, taking it with food, switching formulations, or trying another medication in the same class. And sometimes, what looks like a medication side effect may have another cause entirely. You don't necessarily have to choose between suffer through it and stop the medication. There may be a third option. And this is one of the most important. Maybe one prescription comes from a local pharmacy. Another comes through mail order. You buy supplements online. And you occasionally use a different pharmacy when you're traveling. The problem is, no single pharmacy may have the full picture. That makes it harder to catch duplicate therapies, interactions, or medications that shouldn't be used together. You don't necessarily have to fill everything in one place, but you do need one accurate medication list. Include prescriptions, over-the-counter medicines, vitamins, supplements, allergies, and anything you've recently stopped. Keep it on your phone, bring it to appointments, and show it to your pharmacist. That simple habit can prevent a surprising number of problems. And here's a bonus mistake pharmacists see constantly: waiting until you take your final tablet before requesting the next refill. Insurance issues happen, prescriptions expire, doctors need to authorize refills, medications go on back order. Give yourself a little breathing room, especially for medications you shouldn't suddenly be without. Here's the bigger point. Medication safety isn't only about choosing the right drug. It's about knowing how to actually use that medication in real life. What happens if you miss it? What should you avoid? What side effects matter? When should you call someone? And when should you not stop it on your own? Those are exactly the questions pharmacists are trained to help answer. So use us. Which of these 7 surprised you the most? And is there a medication question you've always wanted to ask a pharmacist? Leave it in the comments. I may turn your question into a future video. If you want practical, evidence-based medication information from a pharmacist, subscribe to Medications Explained by a Pharmacist. And remember, this video is for general education, not individualized medical advice. Never start, stop, or change a medication based on this video alone. Always talk with your doctor or pharmacist about what's right for you.